Hi, thank you, Chairman Fletcher, Dr. Fletcher and board. I'm Dr. Rennie Moon. I'm a practicing pediatrician. I have practiced in this region for many decades, for several decades, and I grew up here in Idaho. I have a disclaimer. My disclaimer is that my words are my own. I'm not here representing any employer, past or present, although I do represent national groups of highly alarmed physicians. We're highly alarmed at what has happened to the ethics of our country and what is happening to our nation's children. So I do represent those groups. Let's talk about informed consent for a minute. This is a foundational value of a healthy, civilized society. We have to be informed and we have to give true and willing consent. This COVID shot, I'm going to talk about that for a second because I've been doing that nationally. This shot never should have been given to our nation's children. There was no emergency for our nation's children when it came to fatalities from COVID. And we clearly have harm to our nation's children from this shot. We have evidence of heart damage. And yes, we've had fatalities. We've had fatalities. And I'm just going to bring up a couple of those fatalities, just so you know that these are real people. These were real people. These were young people, young adults as well. Victor was a 30-something-year-old, I think he was 34 years old, when he died in Seattle, 16 days after the shot was administered to him. His parents didn't have informed consent when they encouraged him to get this shot to help allegedly save grandma, which we know is not true. He wouldn't have saved his grandmother. He died. He didn't have informed consent. Ernesto Jr. was 16 years old. He took this shot. His dad did not have informed consent. He didn't know. He died a week later on the basketball court. He died suddenly. A young lady I've come to know, a 23-year-old who now has a pacemaker in place. She was completely healthy when she was given the COVID shot as part of our military. She has a pacemaker in place. Please, informed consent is vital. My number one choice for this committee would be to remove these shots from the market completely. I realize you can't do that right now or that's not up for a vote, but please, informed consent is a must. Thank you.